I worked for the Social Security Administration for a few decades. I've helped hundreds of thousands of people out, millions. I've taken hundreds of thousands of claims. And one thing I know for sure, there are exceptions to the exceptions to the exceptions. So I'm going to go over some of the biggest. There's over 20,000 pages of policy for the Social Security Administration. Doesn't include Medicare. And whatever you've heard about it, yes, that's the general rule, but there are exceptions to those exceptions. And I'm going to go over a few of them today, and this is a live Q&A as well. I'll talk about the exceptions. Should take about 10 minutes, and then I'll open it up to all of your questions. So make sure you type your questions into chat. If you're new here, make sure you subscribe. That way you can find us in the future in case you, your family, whoever has questions that they need answered. Okay, let's go ahead and stop the stalling and get right into it. One of the first things is you've heard that a divorced spouse can get benefits if they were married to that person for 10 years or longer. And you probably heard the words consecutive in there. A lot of social media people out there say this all the time. And so I spend so much time correcting what social media people say. It's, that's half my job, it seems like. But 10 years or longer does not necessarily have to be consecutive. There is an exception. If you were married to someone for 5 years and then got divorced and then remarried that same person by the end of the next calendar year, and then were married another 5 years, Social Security can add those two times together, 5 years, 6 years, whatever, to equal 10 years. So that is an exception a lot of people don't know about. I looked it up, and about 5% of people remarry the same person. So I used to kind of never talk about it in my on my online classes and my online videos and during live Q&A, but there's 5% out there that did. Survivor benefits, you had to be married to the person for at least 9 months, currently married. So if you were married and you're looking for surviving divorced spouse benefits, then the 10 years, all that I just talked about applies. But if you were married to the person when they passed away, you have to be married. You had to have been married to that person for 9 months. Yeah, and there's an exception. The exception is if the person died in the line of duty with the military, or it was an accident. So you were married in good faith, looking to be there forever, but there was a car accident or something like that, and the person passed away before that 9 months. There is another exception. Medicare. Let's jump into Medicare once here. Medicare plan changes. So everybody knows about the Medicare open enrollment period coming here October 15th to December 7th. Most people, that's when they change or review their plans, go back to original Medicare, out of Medicare Advantage, find a better Medicare Advantage plan, whatever the case may be, and they think that's the only time they can change it. That is incorrect. If you have a Medicare Advantage dual eligible plan, you can change your plan several times a year. If you have the low income subsidy, also called the extra help with prescription drugs, you can change your plan several times a year. If you move, you can change your plan several times a year. If you have a Medicare supplement plan, the G or the N or the F, also called a Medigap plan, you don't have to wait till your entire annual enrollment period. You can change that anytime you want. If you do it after 65 or after one of the special enrollment periods, yes, you do have to go through health underwriting, and it's not necessarily a medical exam or anything. You just answer some questions, and if you're relatively healthy, then you should be able to switch, find yourself, go from a G to an N to save money, go from a G to another G to save some money in a different plan, or whatever the case may be. So exceptions there. Retirement, early retirement. You've heard about, there's an annual earnings limit, $22,320. So people, when they're going to apply for retirement, they say, well, I can't do it this year because I've already made over the $22,320. So I guess I'll have to wait till January next year. No, there's an exception. The first year you can be switched to a monthly earnings limit. So let's say this is August. You made $1 billion from January to August, but starting September, you're going to stop working. You're not going to make $1 billion anymore. You're going to stop working, or the key is you have to stay under $1,860. So the first month you go under that limit, the $1,860, then you can start your benefits. And it doesn't matter what you made before that time. So you can switch from an annual to a monthly limit. And then we have what's called independently entitled divorced spouse, what a lot of people out there are missing. All right, so you've got a lot of divorced spouses out there that are starting to collect benefits on their own record. They're 62, and their benefit is lower than their divorced spouse benefits. But they're sitting around twiddling their thumbs and saying, well, I can't file for benefits on his or her record until they file. No, 100% incorrect. It's called independently entitled divorced spouse. You file for benefits on your record, get your benefits started. And if that person is at least 62 years old, it doesn't matter if they've filed or not. You can file for benefits on their record and start getting some more money. Independently entitled divorced spouse. Another one, spouse benefits. That when you remarry, you're getting divorced spouse benefits, and then you remarry. People think you have to be married for 1 year. Yes, generally yes. But if you're already receiving benefits, then you can switch over to the new spouse within that 1 year. So there's an exception there. Child benefits continue until you're 18 years old, until the child is 18 years old. Then they essentially stop automatically, but they can continue. There's an exception. They can continue until that person graduates high school or 19 and 2 months. Or if the child became disabled before the age of 22, that child can receive benefits for the rest of their life on one of their parents' records. Medicare supplements. Let's go back to Medicare a bit. Medicare underwriting. If you are outside of your golden sign-up period, 65, or new to Medicare Part B, even if you're 70 years old and you just signed up for Part B, that starts your new golden opportunity to sign up for a Medicare supplement, and there's no health underwriting anything if you're new to Part B. So you don't need medical underwriting if you're losing your Medicare Advantage plan. There's going to be millions of people that are going to lose their Medicare Advantage plan this coming annual enrollment period starting October. You're going to get a letter in September next month, and it's going to say, we're not making enough money. Your health insurance, Medicare Advantage health insurance companies is going to send you the letter and says, hey, we're not making enough money in your area. Bye, we're out of here. And they're just going to drop your plan. You've probably seen it in the news in the Southeast, Florida, Georgia, Alabama, Missouri, and there's more coming. There's a lot of changes for Medicare for next year, for 2025. So a lot of people are going to be losing their Medicare Advantage plan. So they either need to find another plan, or because that company is leaving, you just might be able to get into a Medicare supplement plan, return to original Medicare, get a Medicare supplement plan, and you don't have to go through the health underwriting. And there's also, if you move to another state, you can get a Medicare supplement with guaranteed issue without going to health underwriting. And sometimes in particular states, each state does a little bit different. Some states, you never have to go through health underwriting. All right. What about stopping benefits? So if you're currently receiving benefits, that's your benefit forever. If you file your benefits early and continue to get those benefits, the only increase is going to be, COLA increases, or if you work and pay more. So your benefit will not increase once you hit your full retirement age. Once you're locked into that lower amount, you're locked in. However, there's an exception. Within 12 months of filing for benefits, if you change your mind, you can withdraw your application. You have to pay all that money back, but you can withdraw your application and then file later, a year, 2 years, 3 years, 4 years. And it's like it never happened because you withdrew it and you paid all your money back. You can also suspend your benefits once you hit your full retirement age and start getting those delayed retirement credits. It's called voluntary delayed retirement credits. So at 66 and 6 months or 67, whatever your full retirement age is, you suspend your benefits and you just let them accumulate all the way until you hit 70 years old. And if you are receiving benefits early and you go back to work and your benefits are withheld for a particular month, once you hit your full retirement age, Social Security automatically recalculates your benefits. It's called the the adjusted reduction factor, ARF. They they readjust it. So if you were taking a 30-month reduction in your benefits, but you didn't get 20 months of checks, Social Security will automatically recalculate it and you'll get a 10-month reduction for the rest of your life. That's 100% automatic. All right, let's do a few more here. There's, I could go on and on and on, but I'm just going to throw out some of the biggest ones here. Sorry, there's a kind of windy over here, so you might have a little feedback. But all right, survivor benefits, widow's cap. If you start your benefits very, very early from survivor benefits, you'll get 71.5%. There is a widow's cap that your widow's benefits might just max out at 82.5%, and they max out at 62.5. That is if your deceased spouse took their benefits early. So if you're waiting around for survivor benefits because you think it's going to increase to 100% or so at your full retirement age, that might be the case, but if your spouse filed for benefits early retirement, not disability or anything, but if they took early retirement, you might be capped at 62.5. So make sure you reach out to Social Security and find out if you're capped, and there's no use in waiting. Another thing is current spouses do not receive delayed retirement credits. So if you have a spouse, a divorced spouse, or a current spouse that waited till after their full retirement age and got those extra delayed retirement credits, current spouses do not. However, surviving spouses do. So if you're currently married to someone and they've, waited till they're 70, you won't get those delayed retirement credits. You'll just get up to half of their full benefit amount at their full retirement age. However, when they pass, you will get those delayed retirement credits. Another exception is a lot of people miss, unfortunately, and they miss thousands of dollars a year. Medicare, you do not have to sign up for Medicare at 65 if you have health insurance from work, current work, not a retirement plan, not COBRA, not Affordable Care Act, Obamacare, nothing like that. Has to be from current work, your work or your spouse's work. And your employer, that group health plan, has to have 20 or more employees. So if that's the case, you do not have to sign up for Medicare. You do not need to call Social Security and tell them you have, the health insurance from work. That's not relevant. Once you stop working and stop receiving health insurance from that work, or your spouse's work, then you technically have 8 months to go ahead and sign up for a Part B and not be penalized. Legally, you have 8 months, but I wouldn't wait that 8 months because that's usually when you fall or get sick or something. So about a month or two before you're going to lose your health insurance from work, then start the process, start Part B, and then find the Medicare plan that's going to cover you that you like, either a Medicare supplement or a Medicare Advantage. If you need help with that, I've put together a team. And I'm also there's a lot of people that email me and say, hey, put me on the list for October when the new plans come out in October, and we will give you a free review. If you want help with that, just go ahead and scan that, or I'll put my phone number and email up there, and we'll give you a free review in October. Set up an appointment to review your plan and make sure you're in the best plan for you for 2025, because they are only good for 1 year. So your plan is going to expire December 31st, like it did last year and the year before and the year before that. And a lot of people just say, hey, it's still zero premium, it's still got the same card, still got the same doctor, but you're missing all of the stuff under the hood that just might cost you a lot of money, a lot of surprises. So make sure you give us a call. Okay, let's go ahead and get into questions here. Let's see. JP, can insurance deny surgery if needed if I had MRI as self-pay rather than go through my insurance company? Yeah, if you're self-paying, then so you had an MRI as a self-pay. So yeah, insurance, if you have a Medicare supplement plan, that means you have original Medicare, then no. If the doctor says you need a surgery, then you get a surgery done. But if you have a Medicare Advantage plan, then you have to go through essentially the bean counters, the accountants at the Medicare Advantage plan, and they will decide whether you get it or not. That's that prior authorizations. I'm actually doing a video tomorrow on prior authorizations for that and how to avoid it. Can a spouse get spousal support on you if they never put into Social Security? Yes, absolutely. So if you have a spouse that did not work, did not pay into Social Security, fine, no problem. They can collect spouse benefits on their spouse's record. If they're at least 62 and the insured spouse has to be receiving benefits if currently married. A divorced spouse, again, it's that independently entitled divorced spouse. So there's a lot of people in that category that they're not insured on their own record. They just get spouse benefits. Trish, how would I get my ex's Social Security number so that I can find out if I'm eligible for some of his benefit? I have no paperwork of any kind with his number on. No problem whatsoever. I've done this. I've found millions of these. Basically, what you do is you call up the 800 number and you give them as much information you know, the person's name, their date of birth as well as you know it, and the city and state where they were born as well as they know it, and the Social Security employee can find that Social Security number. I've done it a million times. When I worked at Social Security, I've never not found a Social Security number. And then they will get the Social Security number and they will look, they won't give it to you. They will look to see if there's any money on that record, whether it's a divorced spouse or, deceased spouse or whatever the case may be. And they'll look at your record and they'll look at that record and they'll see if there's any money available. And if there's any money available, they will set up an appointment for you. Is the government going to subsidize drug companies next year when the 2000 maximum goes into effect? That's kind of looking what's going to happen, because the drug companies Part D, because they're this year the max you can pay out of pocket is $8,000, and a lot of people are having a hard time, so they decided to reduce it to $2,000. And drug companies said, we're losing money on that because so they were going to raise Part D prescription drug plans from somewhere more like zero this year, $5, 50 cents drug plans this year. And then they were saying, hey, these plans are going to be like $70 now, $80. And that kind of freaked out Medicare. And Medicare says, hey, okay, hey, that's too much. Let's see what we can do. So yes, it looks like it. Last year, pharmaceutical companies spent $400 million lobbying Congress, and luckily they lost, in the sense of Medicare been trying to be able to negotiate drug prices since 1973. Original Part B pays for in-house drugs and stuff like that. But yeah, drug companies have always fought that negotiation. The VA can negotiate, every entity in the world can negotiate drug prices, but Medicare, for some reason, well, I know the reason is because pharmaceutical companies paid off politicians. And but we finally won. But now they're fighting back again. And yeah, so we have to keep at it. I did that. They told me I needed his Social Security number. No, then you just got a bad employee. So yeah, I mean, your last name is Brown, so the employee might have had a hard time if the person's name was John Brown. There's millions of those, but what they do is you tell them the date of birth, and they can do a search, a Nubident search, it's called, within a 5-year period, and pick out all the Browns that were born during that time. John Browns are born during that time, and then you tell them what city and state. And if there's 5 or 6 in the same city, same date of birth, then if you know the mother's maiden name, then easy. So yeah, whoever you talk to, you just had a bad employee. So just call again, and if you get a good employee, they'll be able to find it for you. Very easy. How do you prove you have a disability that prevents you from working and struggling with simple daily functions? I have MRIs, X-rays, and diagnosis that prove these conditions. Have you filed yet? You need to file. You don't need to provide medical documentation. Watch my videos I did on the process. Let me go ahead and pop up the images of those videos. Hold on one second here. So these are the videos I did. I did 3 videos on filing for disability. I recommend online. That way you can take your time, fill out everything, and you put in all your doctor's names and address and phone numbers, send it up to Social Security, and Social Security contacts your doctors directly and gets all of the medical evidence. And if they need you to see a Social Security doctor, they will arrange that as well. So just file. Does 5 out of 10 years of work rule go from now or from time of disability? From time of disability. So what Daniel's talking about is in order to get disability, you have to fulfill 2 insured statuses. The one is you have to have paid into Social Security just like everybody else, 10 years, 40 quarters, and all that kind of good stuff. There are exceptions to that one. But you also need to be currently insured. So 5 out of the previous 10 years when you became disabled. So if you say you became disabled, January of last year, they look at the 10-year frame before that. And you had to have worked 5 years out of that 10 years. So you had to be currently insured. And what the idea there is, if someone was insured for Social Security and, because they worked when they're in 20s and 30s, and then they stopped working at 35 and traveled the world for the next 20 years and then came in and said, hey, I got hurt, scuba diving in Jamaica. And I want to file for Social Security disability because I can't work anymore. It's like, well, you haven't worked in the last 20 years. So that's the whole currently insured type thing. You have to fulfill that as well. Happy to report. There we go. I like it. I got my SSDI just last week. Only took 7 months to get it. Wow, that's actually, yeah, nowadays consider the low staffing. That's pretty good. Did it myself. There you go. No lawyer. You saved yourself over $7,000 right there. Never needed to appeal. Sucks about taxes though, due to wife's income. Yeah, taxes. I can't do anything about that part. So, well, congratulations. I guess, half-hearted congratulations. I'm sure you didn't want to file for disability and all that kind of stuff, but at least you finally got approved. And so remember, you've got the CDRs. I've done some videos on congratulations. You filed for disability, you're approved. Now what? And all the stuff you have to watch out for from now on, continuing disability reviews. And you will also get Medicare after being on disability for 24 months, your Medicare will start at that time. So make sure you watch those videos and yeah, congratulations. Will there be a premium payment for prescription drugs as a change into Medicare for 2025? And will the premium plan B increase as well? Yeah, you mean probably Part B? Yes, definitely. Medicare Part B will increase. And can I call just to find out how I'll get for retirement? So yes, I think it depends what plan you have, but again, there were plans this year that Part D prescription drug plans that were 0 or $5 or 50 cents. I don't think that's going to happen next year. So those plans are definitely going to increase the premium. Part B premium is definitely going to increase next year as well. And I do 99% of my help is free. My Medicare team's help is free. The only thing I do charge for is a private call to pay for all the other stuff. So if you want to talk about your retirement, your particular case, then click that little button there and it's $99. And that pays for all the other help I do. But yeah, if you have a question about your retirement, just ask it here and I'll be more than happy to answer it. I'm a divorced spouse collecting Social Security at full retirement age in June next year. When do I apply for spousal benefits as a divorced spouse? Well, I need a separate appointment. X already receives benefits. Yeah, so if you're going to collect divorced spouse benefits 2 or 3 months before is fine. I guess you assume you were married to that person for 10 years or longer. So you will need the marriage certificate and the divorce decree, the originals of both. Whatever. So people say, well, I don't have the original. No, just contact the issuing agency wherever you were married and divorced, and they will send you the original. It usually has like a raised seal or something like that, or a red stamp. And you just need to provide that. and get your money. Good day. If you need a major surgery at 65 soon and new to Medicare, how soon can you have the procedure done? Is there a waiting period for approval? Appreciate all you do. Hit that like button. Yes, thank you. Hit that like button. No, if you're approved for Medicare, and you can sign up for Medicare 3 months in advance of your 65th birthday. And when you sign up, then I would definitely recommend, you also sign up for a Medicare plan, whether it's a Medicare Advantage or a Medicare Supplement. As I say all the time, I recommend Medicare Supplement if it's in your budget. But unfortunately, over 50% of people in America choose a Medicare Advantage because, they can't afford the monthly premium, or they say, well, I don't want to pay anything because I'm healthy, but later things change, right? But whatever is good for you, pick that one. And that way, the first of the month Medicare starts, your Medicare plan starts as well. Medicare Advantage, Medicare Supplement, and then you're good. If it's a Medicare Advantage plan, then you have to go through all the, getting the approval for the surgery and the prior authorization and make sure you stay in the network and all that other kind of stuff. If you choose a Medicare Supplement plan, then yeah, you don't have to do anything except for, set it up with your doctor. If your doctor says you need it, then you get it. No prior authorizations. So in Georgia, can I switch from a Medicare Advantage plan to a Medicare with a Plan G? In Georgia, I don't think there's any guaranteed issues in that state. So you would have to be healthy, go through medical underwriting. You wouldn't be able to switch from a Medicare Advantage to a Medicare Supplement until October, and then it would take effect in January. So reach out to us, call that number, email me, click on that little QR code thing there and say, hey, Ed, in October, put me on your list for October. I want to see if I can switch to a Medicare Supplement Plan G, and we will check it out. And if you can't, then we'll find you a better Medicare Advantage plan. Medicare Advantage plan, I wish there was a better system, but there's not. I wish everybody could afford a Medicare plan, a Medicare Supplement Plan G, but they can't. I wish it was that. Anyway, but if you have a Medicare Advantage, fine. You just got more work to do. You have to keep up on it, and sometimes you have to fight the prior authorizations and make sure your doctor's in network. But zero premium, kind of get what you pay for type thing, right? So you just have extra work. So make sure you check your plan every year. Penelope, yeah, Penelope's always right on there. Think they told you wrong about finding the Social Security number. Yep, speak with somebody else, a supervisor. Yeah, I've never not been able to find. Sometimes they've been challenging. John Smith. I was like, oh my gosh, there's like 40,000 that were born on that day, and finally found him though. Yeah, because not many John Smiths has the mother with the same exact maiden name, so it was pretty easy. All right. Take it to hey, what's up? Keep up the great work, everybody. 47 upvotes already, 119 watching. Yes, please. Thank you for that information opportunity, sir. Andy, thank you. Hello, everyone. Just Jeff. What's up, Just Jeff? Hello. And all the community. Hope everyone is having a good day. Hit those likes. Yes, please. Thank you. I guess they were too lazy to look. I've tried a couple of times and they told me I needed to give it to. No, yeah. Is that your local office? I would call the 800 number. The people in the 800 number do it all the time. So that's it's substandard. Yeah, customer service. I apologize for that. I ran the third busiest Social Security office in the country, and we've found millions of those. And my 100 so employees, I've never ever heard of anybody not been able to find a Social Security number. I've never heard anybody taking more than 5 minutes to find a Social Security number. So let's see. My former married name was different. Yeah, it's not your. It's your. You're looking for your ex-spouse's number or Social Security number, so you just need to know, their number, their name. So I'm paying back overpayment for Social Security as far as my taxes. My tax repair told me that I'm paying taxes back because I'm paying money back to the government. Yeah. Is this right? Sorry, I don't know your situation there. My friend was dropped from Medicare. They claimed her owed premiums. How can he be reinstated while he fights the case? And who does he contact to look at the case? So, yeah, you need to contact Social Security. And basically, it sounds as though he was receiving Medicare, Part A and Part B, and he was not receiving, he or she was not receiving Social Security benefits, because when you receive Social Security benefits, the Part B premium is taken automatically out of Social Security benefits. But if he or she was not receiving Social Security benefits, then it was their job to mail in the check every 3 months. But it sounds like didn't mail in the check every 3 months and therefore was dropped. So they have to file during the general enrollment period, unless they can prove, yes, I did mail the check, and you cash the check. Sometimes that does happen. So put a trace on the check and see if it was deposited by the Department of Treasury. And if it was, then get it addressed through Social Security. But if the premiums weren't paid, then the only thing they can do is wait till the general enrollment period in January, start, and the Medicare will start February 1st. That was a recent regulation change to make it start sooner. So that's good. Hey there, Ed. If my Medicare Advantage disappear and I decide to go for supplement, is there something I need to do through Medicare, or is automatic if supplement accepts me? Yeah, it's automatic. So if you lose your Medicare Advantage, which millions of people are, they're going to get that letter next week or next month, and keep that letter. It'll say on the letter, hey, we're not making enough money from you and your neighbors, so we're leaving y'all by. It's not going to say it like that, but anyway, I'm paraphrasing a little bit. And then at the bottom, it says, because we're abandoning you, you have a guaranteed issue right for a Medicare supplement plan. Keep that letter, because, again, when you talk to your Medicare insurance agent or broker, if you want our help, when you talk to us, then we'll need a copy of that letter, and we submit it to the Medicare supplement plan, and that way they don't, they can't deny you. So, and then you don't need to notify your other one because they've already abandoned you. So, my husband worked for a city and has the windfall. He's claiming his Social Security now. He's 10 years older than me. I'd be on his record because I was SAHM. Would my Social Security be calculated using the windfall too? Yes, your benefit amount will be based on his benefit amount, and his benefit amount has been recalculated with that windfall offset. What is SAHM? Not sure what that is. So if you also receive a non-covered pension, then yours will be offset, and your non-covered pension will also do the government pension offset from spouse benefits. But I don't think HS. Yeah, I'm not sure what that is. But if you tell me, I'll say, oh, okay, I know what it is now. So, did you say Part B premium will increase again next year? How much do you think? Yes, 100% will increase next year. I have no idea. Yeah, $5, $10, $20. Yeah. What they do is Part A is financed from your FICA taxes, all those money you paid into decades for FICA. FICA, part of it, 6.2% for you goes into Social Security, 1.45% goes into Medicare Part A. Part B is funded by premiums. So they look at how much, Medicare, the doctor part of it, the medical part of it, costs, and then that's how they come up with how much the premiums will be. That's why Medicare Part B will be here forever. It is no, 2030 is going to run out of money. No, Medicare Part E is self-funded, so Medicare Part B will be around here for the next 1,000 years. Medicare Part A, that's what we need to address, and Social Security itself. Or if we don't get on the ball and do it, then we're going to get a 17% cut in 2034 or 2035. So, Rachel, hello. I've had federal employee health benefits since 2002 through my spouse. He's retired from the United States Postal Service. I'm 64 and working per diem. I may work another 3 or 4 years. Can I defer Medicare Part A and Part B? If you have health insurance from work, yes. Current work, and your employer has 20 more employees, so I'm not sure, we're per diem. So if you have health insurance from current work, then you can delay it. Yep, yours or your spouse's. But it sounds like you have federal employee health benefits through the retirement plan. So yeah, you wouldn't be able to delay it. But if you have federal employee health benefits through your spouse and you're happy with it because you're already paying for that, you don't have to sign up for Part A, Part B. Federal employee health benefits don't make you sign up for. Well, you okay? Wait a second. You're the postal service. I think they just started it this year, so I don't know if you were grandfathered in. So I would call up the postal service and find out if you have to sign up for Part A and Part B. Most federal employees don't, but the post office does everything differently. Sandra, I turned 62 in October, but they're not going to give me my benefits until November. So can I work full time up to November 15th? Okay, yeah. You have to be 62 the entire month. So it sounds like if you were born on October 1st, you're good. But it doesn't sound like you were born on October 1st. You were born on any other day. So you're not 62 until November. And then so you can start your benefits in November and you'll get your November check in December. So November, as long as you're under the $22,320 for the entire year, you're good. If you went over that already, you have to stay under the $1,860 in November. Let's see here. They give you a small COLA and turn around and raise your Part B premium. Our healthcare needs a major overhaul. I agree 100%. Yes, I agree. Oh, that's stay-at-home mom. Oh, okay. I thought that was Southern Arizona home maintenance or something. I was wondering what the essay. That was the first time I've seen it like that. But yeah, that's a good way to do it. Yeah. Okay. Yes, I agree 100%. Our healthcare needs a major overhaul. How I would like it is you just got Medicare. It includes A, includes B. There's no gaps of original Medicare where you have to fill with a Medicare supplement or Medicare Advantage because you paid for Medicare for all those decades. And then, it shouldn't have Medicare supplement or Medicare Advantage or have to get an extra dental, vision, or hearing plan or Part D. And it's Medicare is Medicare is Medicare. That's how. If I was a dictator for a day, that's how I would do it. Right after the cure for male pattern baldness. I have my priorities. Sorry. All right, let's see. I'm about to be 60 in November. I have been in remission for 4 years. Can I still apply for disability? Yeah, if you have a disability, whatever your disability is that keeps you from working substantially, this year substantial means $1,550, then absolutely. So if you're in remission but still taking all these medications that prevent you from working, absolutely file for disability. What if you don't pay in Social Security and you're 62? Why can't you get Social Security? Yeah, if you never paid into Social Security, just like any type of insurance, if you don't, pay your car insurance and then you have an accident, I wouldn't recommend walking up to that car insurance company and say, "Hey, pay for my car." It's like they'll say, "Like, who are you?" But for Social Security, they do have what's called SSI, Supplemental Security Income. It's a welfare-based program that if you're disabled, you can get, or if you're aged, 65 and older, you can get. Does my husband and me need to be our full retirement age for me to get spousal benefits of 50% of his? Your spouse doesn't need, your husband does not need to be, but you need to be your full retirement age to get exactly 50%. He needs to have filed. So you file for benefits, he's already receiving benefits, or he files at the same time, and then you file for spouse benefits. But if he's 62 and you're your full retirement age, you'll get 50% of his benefit amount. Doesn't matter what age he is. Let's see. What is qualifying disability? Is there an advantage to go on D over Social Security? Yeah, qualifying disability is any disability that prevents you from working substantially. Is there an advantage to going on disability over regular Social Security retirement? Yes. You get your Medicare a lot quicker. Under regular Social Security, you have to wait till you're 65 to get Medicare. On disability, you get it after 24 months. If you get disability, you get your full benefit amount. If you go on Social Security, you start your benefits at 62, you get a reduced benefit amount, 30% less. So disability, you always get a higher benefit amount. I feel some pain in my heart, kind of feels like when, okay, well, let me see. Floyd Mayweather. So I used to see him all the time living in Vegas. Do you receive more money in New York City on Social Security than in Florida when filing? Nope. Um, well, that's not 100. One of the exceptions. When I talk about exceptions, that's why I hate all these social media people. They give out the general, information, but they fail to mention all of the exceptions, and people lose benefit. So that's why I decided to start doing YouTube. Um, if you're talking about retirement benefits, survivor benefits, spouse benefits, disability benefits, it doesn't matter where you are, file anywhere in the world except for Cuba and North Korea, you get the same amount. You can't get money from Social Security if you live in Cuba and North Korea. That's why I say that. Anyway, but if you're receiving SSI, supplemental security income, you get the same amount from Social Security, but some states also give you an extra, like California and some states give you a little bit extra for those people on SSI because of the cost of living there. So disability was denied twice. Does it really take 9 to 18 months for the hearing? Yes. I did a video on that a few months ago, and Savannah, Georgia was at 22 months. Yeah, but the new commissioner is really, every commissioner that comes in, every commissioner that I had when I ran my office, as soon as they came in, they're like, oh, yeah, we're going to finally get down the hearing times, the 600 days pending, 700 days pending. And then they do it, and hey, I did my job, and then they forget about it, and then the next commissioner has to come in and do it all over again. So I would argue all of that is planned to deteriorate customer service, so people just get completely frustrated and give up and say, let's just go ahead and give it to Wall Street. And yeah, so let's see. My attorney said I was denied SSI, but I got SSD. You just said they give both. Yes, you can get both SSI and Social Security disability insurance, but the SSI, um, you have to have low income and resources. So if you got more than a couple $3,000 in the bank, you're not getting SSI. If your Social Security disability benefits is over $943, you're not getting SSI. So yeah, so SSI is a welfare-based benefit. If you're getting more than the welfare amount, then you're not going to get SSI. My wife has never worked a day outside the house. She will be only 56 this year. So what would be her full retirement age? 67. I assume, yeah, 67. Your wife has never worked at the outside the house. So she is a SAHM. Okay. Right. All right. Learn something new every day. Thanks, Ed. I owe you another beer. Ah, thank you. Appreciate it. One beer, Weir. One beer is all it takes. From California, how to qualify for QMB for Part B and where do I apply? Good question. QMB is Qualified Medicare Beneficiary, and that is a Medicaid category. That's the highest category for Medicaid. Actually, I think there's QMB plus in some states. But anyway, so you apply through your state. In California, it's through Medi-Cal because California likes to do everything different. Medicaid in California is called Medi-Cal, and you just call Medi-Cal and you apply from there. Or if anywhere else in the country, you apply the Medicaid office, you apply Department of Welfare, Department of Social Services, wherever the case may be. And if you have your Medicare and you're paying for Part B and it's difficult to pay that $174.70, please get the word out there. Apply for Medicaid, Medi-Cal, whatever, and they just might pay for your Part B premium. It's called the Medicare Savings Program, and they will pay for your Part B premium, and then you will be dual eligible. You will have Medicare and Medicaid, and if you have both, and your Medicaid is at the higher levels, then you can get what's called a Medicare Advantage dual eligible plan, and those are the ones you see advertised all the time with all the extra money, electric cards and over-the-counter cards and all that kind of grocery cards and stuff. So Do under the age 18 children get any payments from a father who is retiring at full retirement age? Absolutely. So if you have a child under the age of 18 and you file for retirement benefits or disability benefits, then the child can get 50% of your full benefit amount. So if you're waiting till your full retirement age and you have a child under the age of 18, some people, because when you file is completely your decision. Early retirement, should I file at 62, 64, 65? Should I wait until my full retirement age, 70 years old? It's completely 100% a personal decision based on your particular case. Do you need the money? Are you working? Are you healthy? Do you have the longevity genes in your family? Is that gonna your tax bracket? Is that gonna knock you up in the tax bracket if you start it? But another thing for you is you're saying, okay, well, I'm going to make, $20 more, $30 more if I wait till your full retirement age, but you have a young child and you're going to miss all those months of benefits. So it might behoove you to not wait till your full retirement age, might, you know, start now so your child can get one, two, three, four, five, six, 7 checks or whatever the case may be. So that's another consideration you have to consider. I'm 62 and haven't worked in 6 years. I want SSI. What will happen while I apply? I just got the email yesterday that Social Security is finally, after decades of trying, they put the SSI application online. So SSI is the welfare-based program. But if you haven't worked in 6 years, that doesn't really matter. For retirement benefits, as long as you worked sometime in your life for 10 years, then you're insured for Social Security. It doesn't matter if you haven't worked the last 6 years, not an issue. So if you are insured, then you call the 800 number, schedule an appointment, you go online and file for retirement benefits, or if you're not insured, SSI. But SSI is the welfare-based program, and you would have to be disabled because you're not 65 yet. Let me see here. I applied for disability and got denied twice. Does it take really, 9 to 18 months for hearing? Yes, it does. Remarried before age 50, so can't get spouse benefits. Yeah, if you remarried and are still married, then you cannot get divorced spouse benefits. But if you've since divorced, then you can. You can. Let me see what other kind of. Let's see. Other questions here. Okay, I already answered that one. I was also underpaid on my settlement. What should I do? Settlement, not sure. Settlement. Is that like a lawsuit or something? If you were underpaid based on disability, then you can appeal that. So if you think you should have gotten your more checks because you think your onset date, your disability onset date should have been earlier, you can appeal that. But you're reopening your case. So if you say, yes, you approved me for a year ago, but I was actually disabled a year prior to that, then you can file and they will reopen your case, but they are going to reopen your case. And you can read between the lines there. Someone else might look at it and say, wow, this person should have never been approved in the first place. And then, yeah, so. I spoke with Medicare regarding my intention to delete Part B because I have federal employee. He said I would be penalized because the new laws will not allow it next year. Okay, so yeah, you have United, your postal service, yes. So every other place, other federal employees don't have that. Postal service did. Getting good at these YouTube graphics. Yeah, a little bit at a time. A little bit at a time. Back pay, yes. Okay, yeah, not a settlement. Back pay, yes. So, yeah, I've seen it happen. Yeah, I've taken tens of thousands of appeals. I used to work in the appeals section before I became the manager, and a few people did that where they, reopened their case because they wanted an earlier onset date. All the people I had, they were just denied the earlier onset date because, the time when they filed the application and all that kind of stuff, they couldn't go back. None of them were reopened and they just stopped benefits completely, but it has happened. Is it normal practice to have your Social Security disability denied twice, which pays out more SSI or SSD? Yeah, yeah. Unfortunately, a lot of people get their disability denied twice, and that's why you go to the appeals, the administrative law judge stage. And which pays more? It depends on your particular situation, but Social Security SSI only pays up to $943. And if you paid the max into Social Security for 35 years, then your Social Security disability would be over $3,500. So Social Security disability, but it really depends on your situation. So what happens is SSI and Social Security disability insurance. If your Social Security disability insurance is only $500, then you get SSDI. And then if you have low income and resources, you can also get another $443 from SSI. So you get SSDI and SSI. Again, if your SSDI is lower and you don't have, money in the bank and all that kind of stuff. Disaster disability payments start immediately. Disaster disability, I'm not sure what, never heard of disaster disability. Terry cases, I've had Terry cases where the disability, I've taken disability claims from people and they were approved like the same day. Terry cases, terminal illness, but I've never heard of disaster disability. How does Social Security determine how much money you receive if you get disability at 63? It's how much you paid into Social Security all those years. Is there an age limit as to when you can collect survivor benefits? Nope. You can get it all the way until the end of time, your time, obviously. Yeah, on this TikTok thing, it's easier for me to read the YouTube questions because I've just got this little TikTok thing. So yeah, I've unfortunately, TikTok is not good at being able to read questions. So come on over to YouTube. Let's see here. Don't forget, no pay for the first 5 months. Correct. You do not. Nobody gets paid for the first 5 months of Social Security disability insurance. Sucks big time, but that's no. They make sure your disability is serious and really keeps you away from working. Yeah, yeah, that's kind of the argument. But yeah, the first 5 months. One thing I would change that one. But one thing I would definitely change is um, 24 months to wait for Medicare. That's, come on, you're on disability. You need your health care. So as soon as you're approved for disability, if I was the enlightened dictator of the country, I would make Medicare start immediately. So can you see what your Social Security is at before you retire? Absolutely. Um, Go on to socialsecurity.gov, set up an account. It's a little bit more difficult to set up an account now. They're trying to make it more, safe for people, which is a good thing. So go in there and set up an account, and it'll tell you exactly how much your benefit will be at 62 versus 65, 67, and how much your disability benefits. Is it accurate? That's the next question people ask me. It really depends on how old you are. Because if you go in there and look at it at 50, what it's doing is it's saying, okay, at 67, here's how much you're going to receive, but you've got 17 years ahead of you. So if you stop working over the next 17 years, that number is definitely not right. If you start making a whole bunch of money, that number is not right, because it basically says, it looks at your last year, last couple of years, and it says, oh, okay, this person is making about this much money. Let's assume they make the same amount of money for the next 17 years. And that's where you get the number. So, but if you look in there and you're 66 years old, that's going to be a very accurate number. So, sister age 62 on disability, babysits, travels, bike rides, etc. How can she get disability? Yeah, some people, there's physical issues, mental issues, yeah, all kinds of ways you can get proof for disability. But if you think someone is not supposed to be getting disability, then you can report it. Can they even do something about these overpayments, even if it is not your fault? Yeah, they two things have to be met to get an overpayment waived. It's not your fault, and you do not have the ability to repay. So if we pay a millionaire an extra $1,000 because it's completely our mistake, It's like, oh, okay, you're a millionaire, so go ahead and keep the $1,000. People would be upset. So that person has the ability to repay the thousand. Yeah, we paid it to you mistakenly. It's our fault. Sorry, but we did give it to you, right? Yeah, we gave it to you. You make $1 million a year. You can pay that money back, right? So those two things have to be met. It's not your fault, and you don't have the ability to repay. So I've done a few videos on overpayments. Um, my question is, how long before retro and back pay approved? Probably the ALJ. Yeah, how long it takes to get your money after you've had a hearing, after you've seen a judge. That could take weeks or months. It really depends, because once you're approved by an ALJ, they say, yeah, we'll go ahead and approve you. But then the judge has to write it up. The case writer has to write it up, give it back to the judge. The judge signs it. The judge sends it to the local office or the processing center. If you have an attorney that needs to be paid, they have to cut out the $7,200 for the attorney. If you've got early retirement at that, or if you got SS, so yeah, that it could take, all kinds of variables. So just keep up on them and tell them, hey, I need my money. So as quickly as you could expedite this, I would appreciate it. And they'll see what they can do. Let's see. Deborah, what's up, Deborah? I will be retiring next spring at age 70. Should I email you now or wait a few months? Yeah, next spring. So you're going to retire. So you're going to stop receiving health insurance from work at that time. Yeah, a couple, 3 months before. So you're going to go ahead and sign up for Part B. At that time, remember, you're going to need two forms, the 40B and the 564. And one of those is to sign up for Part B, and the other one is to avoid that penalty. So you basically need your employer to sign a piece of paper that says, yes, Deborah had health insurance from current work since she was 65 years old. Don't penalize her. And then your Part B will start whenever you want it, the month you turn 70. And a couple of 3 months before that, reach out to us and we'll go through all of your options on Medicare Advantage and Medicare supplements and all that other kind of good stuff. Is it normal for a judge to rule on 80% disability? What if someone has had a change to 100%? Yeah, there is no such thing as that. That's a VA, Veterans Administration type of thing. 10%, 20%. In Social Security, you're disabled or you're not. So there is no partial disability. You get a check or you don't get a check. So let's see. What percentage of federal tax do they take from Social Security disability insurance? 0, unless you tell them. Yeah, they don't take automatically. Social Security does not take Social Security federal tax out of Social Security disability. You can if you want. I'm not a tax person, so I'm not going to give tax advice. Talk to your accountant. But if you want, rather than having to pay it all at one time, next year, you can do what's called a W-4V, a voluntary tax withholding. And you just tell Social Security, hey, take out 7, 15, 22% of my benefits and send it to my buddies at the IRS. And you can change that every year. So what a lot of people do when they file for retirement in the sub, they say, yeah, I want to go ahead and take out, how much should I do? And I say, well, I don't give that advice, but um, take out 7% or 15%. And then next year you look at it. And if you have to pay taxes or you didn't pay enough or whatever the case, paid too much or whatever the case may be, then you just fill out that form again and you change it to 7 from 15 or from 15 to 7. You can adjust it every year until you get it tweaked just right. So you don't have to give Uncle Sam money every month. Well, you still do, but you don't give him extra money. So, yeah, in terms of, the 85% of your Social Security benefits are subject to taxation at whatever tax rate you are. But if 40, 50% of people on Social Security do not pay taxes on their Social Security because they're not at those thresholds. Going to Social Security office in the morning to file for Social Security disability insurance. It's complicated. Wish me luck. Yeah, good luck, Brenda. Make sure you take your doctors, your information on your doctors, when you saw them, their phone numbers, addresses, your prescriptions, and don't let the person rush you. The Social Security is way understaffed, so that person probably has another 10 appointments after you. And yeah, so make sure they treat you right. All right, I'm over an hour, and a lot more questions, unfortunately, but wasn't able to get to them. If I will be back again tomorrow.